best thing about Medicare compliance. So why I get so passionate about Medicare compliance is we release new content every single month. That also gives me the opportunity to put new features in Medicare compliance every single month. And it just rolls out to our customers and it's instantly absorbed into their systems. So things that we've been working on in the last year, we did a huge project on keywords. And this is really important for our payers that work in multiple jurisdictions because you may have the exact same service, so something like an MRI, in one state where that particular LCD is coded with keywords, and then that same service, that same MRI in another state where the LCD isn't coded with keywords. And so when that happens, if you put a keyword in, you're only going to get this state, you're not going to get that state. And that's the kind of functionality that you see on the Medicare website where it's inconsistent because you have 7 different MACs across the country writing these, and they all think about keywords a little bit differently. And so what we did is we actually pulled all of the LCDs across the entire country, looked to see if any MAC had used any keyword. And if they did, we made sure those keywords appeared on all of the policies that were for the identical service. So same keyword works in every jurisdiction, regardless of whether or not the original MAC actually added it. So that just increases that consistency of those search results, just helps our clients really be assured whether or not there is a policy or there isn't a policy and they need to go to a secondary resource. So that was big for us. Another thing that we did within keywords for those that are working with medications is we added both those brand name names and those generic names to all of our policies. So a lot of people will look up drugs and you never know if they're going to look that drug up by the generic name or by the name brand name. Usually it's basically based on whichever one's easier to pronounce or spell. So we went ahead and went through all of the guidelines that reference any kind of drug or biologic, and we added both the brand name and the generic name to make sure that those keywords would bring those things up. Some of the things we're working on in that area in the future are things around molecular diagnostics. So a lot of the molecular diagnostic policies, the titles have recently been updated to describe the molecular diagnostic test, but not actually name an example of an FDA-approved molecular diagnostic test that would align with that policy. And so now that's making things really difficult because our providers, our clients, whether they're a provider or a payer, like they know the name of the diagnostic test. They don't necessarily know what category it fits in. And so we're going through again and pulling those names of those FDA-approved companion diagnostics and adding them as keywords to all of the molecular diagnostics guidelines. So again, you can find the right guideline for the test that you're actually doing for your clients. So that's been really big to help with that security and knowing that you are going to find the right guidance that you need the very first time without having to memorize a list of keywords that works for a certain jurisdiction. So that's one of the first things that we worked on. And the next thing that we've been working on is really pulling content in from other locations. So about 18 months ago, there was a change request that came out that told the Medicare administrative contractors that they could no longer quote any other CMS resource or any other law or statute as part of their local coverage determination. And really the problem with that is the coverage criteria for a single service isn't necessarily all found within the LCD. So they might, for example, like a drug, they might cover FDA indications, which are found on the FDA website, and then cover additional off-label indications, which are found in the LCD. And so what used to happen is the Medicare administrative contractors would pull that information from the FDA, put it in their LCD, and then put their own indications with it. So once this change request came out, then what you would get is a reference to the FDA where you would have to go look up that information and then the off-label indications. And so just for ease of use for our clients, we are now actually going out to the FDA, pulling that information, putting it back into the policy so that you can see it in one guideline in your system the way that it used to be. And then we're also fully citing that. So if we have pulled information from FDA, if we have pulled information from the internet-only manual, manuals or any other source and put it back into the guideline where it used to be, you're going to get a separate citation for that so that you know that that is that information that they're referencing in the LCD. So again, just trying to keep people in the guideline as much as possible so they don't have to use multiple resources to make a Medicare determination, which really without MCG is what you have to do. Like, you have a lot of different places that you have to go. So that's been really exciting. The other thing and kind of last thing we've been doing within the content is what we call navigational notes. And again, it has to do with this concept that sometimes the criteria for a single service is going to be split over multiple guidelines. And so when that happens, we're going to add additional notes to a guideline to let you know, hey, so maybe we're talking IVIG. Most of those coverage criteria are in the LCD, but this one coverage criteria is actually in an NCD. So we have a note right on the top of the guideline that says, if this is the diagnosis you want to know about, you are in the wrong place. You need to go to the NCD and look over there rather than getting you all the way through the LCD, realizing it doesn't match, and then go hunt and peck for another guideline. So lots of little tips and tricks within the content in order to get you to the right place, know if there's a right place to be, and then also keep you there so that you can make a determination in one place.